What's up, everybody? My name is Yusra. I'm a licensed clinical social worker, a working therapist, and I love pop culture. This is part 2 of our deeper dive into clinician scenes from Big Mood.
Hey, Dr. B, I'm just in the middle of a yoga class.
Where are you really, Maggie? Because I am sending an emergency team to you right now.
What? No, you can't do that because I'm having a dinner party with my friends and my agent and with an all-vegan menu.
What?
Yeah, I'm having a vegan dinner party with my close friends and my agent to thank her for the contracts.
Oh, well, I wouldn't want to interrupt anything so stable. I look forward to seeing it on Instagram.
Stalker.
So, like we talked about before, Dr. Burrows has not built rapport with Maggie, so there isn't trust there. Maggie is trying to tell Dr. Burrows what she thinks Dr. Burrows wants to hear. And Dr. Burrows is acting as an authority as opposed to being collaborative with Maggie towards this common goal of good health. Your therapist is not checking your social media. Therapists are not interested in what you are posting. We're interested in knowing what you bring to us and what you want to talk about. And if part of that conversation is having a healthy relationship with social media, that's an entirely different, perfectly valid and valuable conversation. But they're not checking up on you.
Stalker.
Trying to see what you're up to by checking your social media. So don't you worry about that.
Hi, I need an emergency appointment for today, please.
So did something happen at the dinner party? It seemed to be going so well.
Dr. Burrows, the dinner party was a sham. I am like the most depressed I've been in years, and I thought I could have beautiful mind myself out of it, but one thing I didn't factor in was that dude was like a Nobel Prize winning genius, and he like invented maths or something, and I wish I could think my way out of bipolar disorder. I wish I could like use a meditation app or go for a walk or have an expensive vitamin regime and be grand, but I can't. I need lithium because without it I might die, and it might not seem like it right now, but I don't want to die. I don't want to die.
Wow. Really powerful. Maggie is actually being vulnerable. She really wants to make changes, and she recognizes that she has to ask for help, and that's a really difficult thing to do, to ask for help. I think it's also really poignant talking about the way that she talks about not wanting to die. Oftentimes we think about suicidal ideation or suicide as somebody who wants to die, but actually for so many people it's just that they want their life the way that it is as it is going to end, but they don't actually want to die. That's part of the path forward, is holding on to this idea that your life is worth living. The way that it is right now will not be the way that it is forever. And you are capable of making changes and making choices and getting help so that your situation is different from what it has been.
Sorry, your dose. What was it?
Dr. Burrows does have this moment of looking at Maggie with empathy, but doesn't really get into the use of active listening skills. Like
Listening. She's not listening.
Maggie just went full vulnerable, and Dr. Burrows doesn't really address it, just goes right into, okay, let's get your medication, which is sometimes the reaction that people have when there's an emotional situation, they don't know how to respond.
Are you serious?
Is they just kind of go to the practical, like, let's move on from this emotional moment, and also I'm going to try to fix it. Where, a clinician does want to, does have the skills, is trained to have the skills to actually talk about the emotions that are happening there.
1,500 milligrams. Something like that, yeah.
You should have noted that.
She should have that on file, Dr. Burrows, what the past dosage was. Should not be asking the patient and just writing that down. Lithium toxicity is a real thing. People who are on lithium need to be getting their blood checked regularly to make sure that their lithium levels are within a normal range. Otherwise, they are going to have other side effects.
Being a psychiatrist seemed really hard. I couldn't do it.
She did not go over the side effects or having a follow-up visit or getting blood tests, all things that would be very important when discussing lithium. Follow-ups are important regardless of what medication is being prescribed, because the clinician would want to keep in touch with the patient and make sure that their medication regimen is working. Typically with psychiatrists, I suppose that's what Dr. Burrows is. I identified her as being a psychiatrist specifically. So psychiatrists do work on medication management primarily. Typically, a patient is usually seeing a psychiatrist like once a month or once every 2 or 3 months if things are pretty stable, but wouldn't go for too long without seeing the patient, because things can change and these medications affect the body differently as time goes on. And then otherwise, if things are newer or there's more symptomology, then a psychiatrist would be meeting with a patient on a more regular basis. However, one thing that doesn't get addressed here is having a talk therapist. So if Dr. Burrows is not a therapist, she's a psychiatrist, she's doing medication management, then you would want to have a discussion about getting a therapist for Maggie so that she can see someone on a much more regular basis. So most of the time it's every week or every other week. Sometimes there are clients who are experiencing things with a more intensity. They might be seen twice a week, but usually it's every week or every other week, but that's on a regular basis. So they're meeting with a mental health professional to talk through what they're experiencing. It's also really helpful, particularly with bipolar, to recognize what their bipolar symptoms are so that they know when they need a different kind of intervention. People with bipolar might be taking their medication regularly and still have a depressive or hypomanic or manic episode, and it's important for them to be able to recognize when that is happening so that they can get the appropriate help. This last bit there, when Maggie talks about how difficult it probably is to be a psychiatrist, I do get that quite a lot from people, whether they're my clients or just people that I meet, that it must be really hard to work in this field. And it absolutely has its challenges. I don't know anyone who works in the field who would deny that, but it's also incredibly rewarding to be able to walk with people as they're going through difficulties, to feel trusted with people's vulnerabilities and to hold that space for people. Something that's not really discussed much is that it can be really fun because you're talking to different people who have different experiences, and people are really interesting and complicated and funny, and it's really a privilege to meet so many interesting people all the time. So those were the clinician scenes from Big Mood. What was something that shocked you the most of what Dr. Burrows said? Let me know in the comments below. And remember, progress is not linear.